Good afternoon. How are you today? My name is Dr. Andrew Michaels, and I'm here to help you. We're quite rushed today, so I won't ask you to delay a possible treatment any longer than we need to. I just have a few questions for you before we get started. May I have your permission to ask? Thank you very much. Okay. Your full name, please. No. No, that won't be necessary. And your date of birth? I'm so glad that you were able to come here today. It's very important that we see you right away. And I understand that you feel you may be contagious, but rest assured, I'm positive you are not. But precautions have been taken. In fact, before I inadvertently touch your person, I've been known to do it. Touch the patient and then touch my face directly. Let me put on my gloves. With any new disease, there's always fear. Fear is such a rampant part of controlling a disease because it makes people act erratically. And the more erratic people act, the more random, the more dangerous. See, there I go, touching myself again. If people are unaware of a disease and the spread of a disease, they act normally. But if they think there's a communicable disease nearby and that someone might be a carrier, they begin to act very erratically. Their actions go out of the routine. Their actions become random, focused on an escape plan that doesn't exist. Putting their own lives and the lives of others at jeopardy. So you could understand, your government isn't keeping this disease a secret from the population as much as they are containing potential disasters because of it. One time during a outbreak that was perceived to be a zombie apocalypse, yes. There was a zombie apocalypse. It was in the Midwest, near Kansas City. We almost had an errant nuclear missile launch towards a tactical nuclear missile launch towards that city in hopes of eradicating the zombie infiltration and infection. And here it was a chemical, a biological disease attacking the minds of the people of the city. And the atomic weapon would have done nothing but cause more damage and killed more people. More people. Sometimes things are our worst enemy. It's quite possibly ourselves. Wouldn't you agree? I know you have a lot of fear right now. You're fearful because you think you have some kind of disease that you can't walk away from. I think you're going to be all right. And I'll tell you why. You'll be under constant surveillance and care from this point on. So if there's anything we can do to help you, we will. If I may, real quickly, I would like to listen to your heart and your lungs, if I may. Could you breathe in slowly for me? In and out slowly. Could you breathe in and out again? There we go. I'm very troubled by this. Doesn't sound quite right. Try again. Would you take a deep breath and hold it, please? Okay, thank you. Very interesting. I'm not a true medical doctor. I am an astrobiologist, so some of the things I would look at might not be what a general practitioner would look at, but at the same time, I have a different perspective on these things. Where exactly did this virus come from? Is it terrestrial in origin? Or is it from an errant tail of a comet? It is possible. It's unlikely, but it is possible. A traveling icy asteroid could penetrate the planet's surface, releasing a virus hereto unknown to science, and now it has entered your body. We definitely need to get some samples. we could take the smallest of scrapings would work. Now, I'm going to describe a type of treatment that we would like to do with you. I need you to look down at what I'm going to draw out for you. Now, this is a cell of your body, and this is the nucleus. What happens is a virus approaches. And it enters the cell and makes it sick and replicates itself using the strength and energy and materials of your cellular structure. Your white blood cells are attacking this virus. They're swooping in, basically devouring it. Now, the problem we have seen with this particular virus, it's very peculiar. As it replicates, one in 100, one in 1,000, it's able to replicate a copy of itself. While being digested by the white blood cell. Now, 1 in 100, 1 in 1,000 doesn't sound like a lot, but when you multiply it times millions and millions of cells all over your body, millions and millions of cells trying to fight this disease, it starts to add up and it starts to increase the number. So you have the virus replicating from normal cells and slowly destroying the body's defenses to it. Now, once it seems to get a foothold and destroy enough white blood cells, they resemble the white blood cells. They mimic them, if you will. They begin to replicate freely because the white blood cells believe that they are other white blood cells until it's too late and they attack. Now, once one of the viruses attacks your white blood cell to devour it, to stop the attack, the other cells recognize it at that point and can attack it. But your immune system is, of course, weakened at this point. So, you can imagine the fight isn't going well. Now, I know you feel good, but I know you feel, dare I say, normal. But you're far from normal at this point. Now, I would like to look on your body for a potential place to get a sample of tissue. It will be a minor scraping. Is it all right if I use this very strong light? And this magnifying glass to survey your skin area. Thank you very much. Okay. You can close your eyes and relax while we're doing this part. There we go. I don't know exactly what I'm looking for. That's part of the problem. You just never know about these things until you look around and see what there is to see. I sometimes think we don't put enough effort into our investigations. We need to figure out what is and what is not the reality of the situation, and then we can begin to proceed in a more economic fashion. Wouldn't you say? I think so. I think so too. You've been very patient. For a patient. It's not very funny. Not very funny at all, especially when your health is concerned. I have an area I'd like to perform a small scraping on, if you don't mind. There's the slightest amount of discoloration. You know, I'm not sure what troubles me the most. Now, if you can hold still now, while I perform the scraping. Right there. Well, I can tell from the discoloration I'm definitely in the right place. Hold on, let's do one more over here. Okay. Yes. Ah, very good. Very, very good. Oh, that's very good. Let me wipe that area off. An exemplary job. Thank you for holding so still. Very good. Now, I think we've got that wiped off. Very good. I'm going to send that out to the lab right away. We're going to get a good look at that. And while we're waiting, I'm going to take one more look at it. If you don't mind, that area again. Oh, yes. I definitely chose the right area. Oh, yes, I feel very good about it. Very good about it. And this other area, right in here, is most peculiar. Ah, yes. Right in there, very peculiar. Very, very, very peculiar. I think we've definitely picked the right area. I think I'll look with my infrared just to kind of feel around a little bit. That's definitely an outward example of the virus in your body. I definitely got to change gloves at this point. Yes, I would feel good about it. I think we've definitely... Those gloves, in fact, I'm going to send in to further testing themselves. The first course of medication, do you feel better? You feel better already? Good. I notice you haven't coughed or sneezed the whole time you've been here. I find that most encouraging, don't you? Yes. Mm-hmm. Now, quickly, I'm going to give you a small injection right here in your body. Right about there. And we're going to wait 30 seconds to see how the injection takes. And of course, I'm going to need some reactions from you. Just a few more moments if you can hold on. Thank you very much. Are you feeling drowsy? That is to be expected. Okay, about 30 seconds have passed. As we've asked before, are you feeling drowsy? Okay. This new course of medication relies on the fact that the body needs its rest. It also is going to induce a minor fever that you will be able to sleep through. The fever will be controlled, of course. We will not let it go rampant. You will be under constant surveillance. Do you feel a feverish body temperature coming on? Yes. Thank you very much. As long as you can stay conscious. Do you feel an acidic taste in your mouth? No? No. Okay. Thank you very much. I would like to check your eyes. Mm-hmm. And the other one. It's definitely affecting your vision to a degree. And I'm just going to check your tactile reactions here around your jaw. Like balloon up your cheeks, if you will. Mm-hmm. There you go. Very good. And the mandible. If I may check your reflexes, if you don't mind. Thank you very much. Just your elbow and your arm and your wrist and the other one, your elbow. Thank you. Wrist. I think you're all right. You're definitely responding as prescribed. Is the fever starting to make you want to sweat or vomit? You do feel like you might vomit. Okay. Have you eaten anything today or had anything to drink? Okay, we will definitely get you a bag right here. Thank you. Bring it here. Bring it over here. If you feel you are going to be sick, it's okay. Do you want to sleep now? You still feel good? Okay. Yeah. It's very interesting. The color of your eyes are so purple. You started out the session with a brown eye. Now your eyes are very purple. Could you come here and take a look? I'd like to get some photographs of that. We can take some photos while you're asleep if need be. I'd like to continue asking you some questions. purplish hue around the edge of the eye. It's very interesting. You have a desire, to get crazy, to get down, to get loose. I can understand that. You want to dance. I don't think this is going to invoke a tarantellin. Do you know the tarantellin? When somebody was bit by a spider, they would perform a powerful violin song that the people infected by the poisons of the spider would dance vigorously to push the poison out of their body. Through sweating profusely, you are beginning to sweat profusely. Let me dab your face so that it doesn't get into your eyes. This is definitely living up to its reputation. You're sweating out the virus. The virus is leaving a purplish hue. May I have a small bit of your saliva? See how purplish it is? This is very telling. The purple rain infection is definitely what you have. Got to keep him hydrated. It's okay. If you feel like just getting nuts, it's quite alright. But I would hope that you would stay as close as possible to aid, because we need to monitor the virus in your body, which obviously is being dispelled at this point from the injection that we gave you. Your bladder is full. Well, most definitely there is a small urinal in that wash cupboard. You may use it. And please, could you get us a sample? Yes, you could use this cup right here. There you go. I can't believe how everything is just coming out purple. Can you? It's definitely purple rain syndrome. I've never seen a case this bad before myself. We've definitely got to get some photographs. Is your urine purple? Thank you very much. We need to get that tested right away. His body is definitely dispelling this. Now, you may come over here. Sit down for a moment. We're almost done. I have given people antibiotics in the past for several infections that came from outer space. And when we gave them the horse pills that they swallowed, these huge antibiotics that the NSA helped us develop, along with the Department of Navy Special Services, their urine and sometimes their perspiration turned orange. Orange was a typical reaction to taking this very potent antibiotic. You may have experienced this yourself in the past. But I've never seen a purple reaction. If you remember, the injection was a clear fluid. But what it does is it pushes the virus from your body, helps your body dispel it, and when it does, it comes out in a purplish hue, if you will, H-U-E. Thank you very much. Well, I'm glad we were able to cure you of this disease. I think you're going to make a full recovery. I do. I think you're going to be better very soon. And with that, you'll be able to go back to living a normal life. Well, it was very nice to meet you also. My name is Dr. Andrew Michaels. And you have a most blessed day. It's nice to meet you. Yes. Just a precaution. You can understand that. Well, let's get you somewhere where you can boogie the night away, if you will, and get rid of this disease. And hand towels will be provided to daub the sweat from your forehead. Have a nice day. All right. Bye-bye. Bye-bye. Yes, you may go. Please take them to the recovery room.